myself. I really feel humbled by that. Anyway, and the other thing I want to say, I guess I need to feel very fortunate to be in a country, which was stated just a little while ago, that is still the richest country in the world, despite a $16 trillion debt. Wow. Okay, there it is. As a part of that debt, it is costing us $1.2 million per soldier in Afghanistan per year. Now I'm listening to all these cuts. $1.2 million just for the soldier, nothing else, okay? And what I'm going to be talking about is mental health care. And even, I'm sure the mental health of the veterans is insurmountable. I can't even begin to cover all of that. As one soldier comes back, 1 in 5 come back with PTSD, and the lines and lines to be able to get mental health care. One person in 17 in the United States needs serious mental health, serious mental health problems. And because of the lack of mental health, it affects our communities. Not only does it affect them, and I'll tell you right personally here in Seattle what it affects. It's called the Involuntary Treatment Act, ITA, meaning that if it's someone who is considered gravely disabled and can injure themselves or someone else, can be hospitalized for 3 days and then reevaluated. But there's no places to put them. There's no psychiatric beds. So where do they put them? They house them in the emergency rooms. They house them on the floors in the hospital. And in the hospital where I work, 2 nurses were assaulted, one so badly that she was out of work for 6 months. The other one was being strangled with her own stethoscope. And these patients are free to roam in the hospital. These nurses and doctors and everywhere are not equipped to take care of them. Each one of you could be in the hospital and have that poor person next to you. They're free to come and go, mind you, and they could go right by the nurse's station desk. Oh, there's a pair of scissors. Oh, there's a nice sharp fountain pen. Who's to say at what state of their disability is? And this is standard in our community hospitals here. So mental health, huge. The funding has been cut. I have my personal experience with a family member who recently I had to try to find who had no insurance, to try to find some mental health for. I must have made 100 phone calls at least to try to find some help for him because he didn't have any insurance. So anyway, thank you all for being here. Let's cut those Pentagon monies. Let's bring it back home to us. And if we're so rich, why are we having all of these? Why are having these problems and bringing the war on terror home to us? And it's all of this is just the beginning of creating a perfect storm.